Hello and welcome to our Harrisburg Area Community College Blended Learning EMR program. This discussion is on communication and documentation. We're going to hop around to a couple of different specific topics within this subset of communication and documentation during this discussion, but should give you a little bit of an overview that'll help you kind of synthesize what you're actually getting out of your book. First, communications, hugely important during every single phase of a call. The dispatcher must communicate the location of the type of call. EMRs must communicate with family members, bystanders, with patients, with dispatchers, with other members of the public safety community. And after call, you must communicate through the documentation the condition of the patient and any treatment that you provided. Data communication systems. The purpose of these communication systems is to send information from one location to the other when it's impossible to communicate face to face. The results of a communication system will only be as accurate as the information put into the system. Communication systems can be divided into two categories, right? Those that transmit voice communications and those that transmit data communications. Voice communication systems transmit the spoken word from one location to the other. Radio systems, they are regulated by the Federal Communications Commission, and those frequencies are assigned by the FCC according to the function of that organization type. Right? Radio systems, types of radios, things like base stations, mobile radios, portable radios, and repeaters are the ways in which we get that information from place to place. Those telephone systems are primary for voice communication, landline systems tied together through an above or below ground hardwire systems, and those mobile phones, they work a little different, right? They rely on radio waves between a mobile phone and an actual cellular tower to send and receive messages. Telephone systems are a great backup to those primary radio systems to make sure that we get those calls dispatched in a reasonable and prudent way. Data can be transmitted through radios or phones or the internet. Paging systems can transmit text messages about calls and information about the call that you're going to. Mobile data terminals can transmit information through a radio system to make sure you get all the information you need to be successful as well. Fax machines can use phone lines or radio systems to send written data. Telemetry is often used by paramedics to transmit EKGs and other patient data to online medical control hospitals. Digital messaging, including email, text messages, and social media, can be used to transmit a wide variety of information to our patients and our communities. The functions of radio communication. Dispatch, right? Dispatch may be a voice, text messaging, or other MDT to alert responders to an emergency. It is your responsibility to keep your equipment ready to receive a call when you are on duty. If you are not sure that all information has been received correctly, ask the dispatcher to repeat it. Response to the scene. Learn how to use map or a GPS. The dispatcher may give you further information while you're en route to the scene. If you are delayed or encounter any problems, it's important that you notify dispatch. Arrival at the scene. Perform a visual survey of the scene. Give the communication center a brief verbal description of the scene. Locate and type any incident. Right? You'll get that information from the dispatcher, as well as any hazards that they know of, number of patients, or any additional assistance that's going to be appropriate. Update responding EMS units. Your report for the incoming ambulances that have EMTs and paramedics should include things like the age of the gender of the patient, right? The chief complaint, the level of responsiveness, and the status of their airway, their breathing, and circulation. When they arrive, right, we got to transfer care to those EMS providers when they arrive. Provide them a good handoff report. Make sure they have the information they need to be successful about the patient's current condition. Use the same approach you follow with patient assessment. When you provide that verbal handoff report, it should include things like the patient's age and gender, the history of the incident, the patient complaint, the patient level of responsiveness, and how you found that patient. Pretty darn important to be successful. Patient assessment. Report the status of the patient's vital signs, airway, breathing, and circulation. Describe the patient's results in a patient physical examination. Report any pertinent medical conditions using that sample format. And report the patient's interventions provided and the patient's response to those interventions. Pretty important to get that done. Online medical control is generally used by EMTs and paramedics to secure permission to perform certain skills, to get direction regarding patient care, and to give patient care reports to the hospital. Post-run activities. After you've turned over care of that patient, you're going to need to report the status to the communication center. Hey, we've transferred care. Will be available, or how long it's going to take for you to get available for your next run. Some guidelines, Table 5.1, you find it in your book of effective communication, and just general suggestions to be successful as you transmit these messages via the radio system. Verbal communications. Effective communication means the person receiving the message understands exactly what's been sent, right? That's part of our therapeutic communication loop that's often discussed. Effective communication requires feedback, right? And the receiver needs to communicate to the sender that the message has been received or understood. Both internal and external distractions can negatively affect communications, right? Some examples of external distractions, things like noise, use of electronic devices, or internal distractions, letting yourself thinking of a personal matter when you're on scene. We've got to stay razor sharp and focused on the task at hand because it's really going to make a difference for our patients in the long run. Guidelines for effective communications with patients. Introduce yourself by your name and title. Ask the patient's name and use it. Make and keep eye contact. Use language that the patient can understand and speak slowly and clearly. That is extraordinarily important when we're talking to our patients, to speak slowly and clearly so that they can effectively understand what we're trying to tell them. It's going to make a difference, especially in our older population. Other big things, tell the truth, right? Allow the time for a patient to respond. Give them time. We're not always in a rush. Allow them time to respond. Limit the number of people who are talking to the patient at once, right? Sometimes patients can get overwhelmed by the number of external influences when they're communicating with patients. It's important that the only person talking to the patient, or the people talking to the patient, is very limited, right? It's really going to make a difference for your patient. Big picture. Be aware of your body language and act and speak in a calm, confident manner. It's really going to make a difference for your patient's ability to effectively communicate with you. Respect cultural norms of the patient. Use open-ended and closed-ended questions where it's appropriate, and treat the patient as if they're members of your family because they deserve that level of quality care. Communicating with patients with special needs. Sometimes patients are hard of hearing or deaf, right? Identify yourself by showing your patient your patch or your badge. Touch the patient, right? Make sure they understand that that physical touch is going to make a difference. Face the patient when you speak so that they can hear or so that they can see your lips and facial expressions, right? Speak slowly and distinctly. Do not shout because if you shout, it's going to mess up their ability to read your lips. Watch the patient face for expressions of understanding or uncertainty. It'll help give you an idea or a guidance during that communication as to whether they're understanding what you have to say. Repeat and rephrase any comments in clear and simple language. And when all else fails, write it down. Write down what questions you have and see if they can write you down an answer. Patients who are visually impaired, tell the patient what's happening. Identify noises, describe the situation. Find out the patient's name and use it throughout your examination and treatment. If the patient has a service dog, try to keep the patient and the dog together. That is vitally important to keep that service dog with that patient whenever you can. And it's not necessary to talk louder, right? Not necessarily to talk louder. It's not going to make a difference. Non-English speaking patients, right? Determine how much English they know, if anything, and find an interpreter. More often than not, when a family has several members or even one member that does not speak English, there's generally someone within the family that has the ability to speak English and do those interpretations. And it's important that we utilize those folks wherever we can. Just if you're going to have somebody do do interpretation, it's important that you document who did the interpretation, right? It's going to make a difference for your liability, big picture. Supplement your questions with hand gestures, with finger pointing, and with facial expressions. It's really going to help get the patient the message across that you want to get to them. Geriatric patients, don't assume that all older patients have physical and mental impairments. Some people are pretty healthy. Assess all patients carefully and give them time to carefully assess and respond to your questions. Pediatric patients, familiar objects and faces can help reduce fear. Talk to the patients and the child as much as possible and tell them what they're happening. Be honest and open and forthright with that communication. Ask the patient to hold the child if the illness or injury permits. Tell the child your first name and explain to them what you're doing. Pediatric patients, squat, kneel, or sit down at the child's level and establish a baseline eye contact. Be honest, right? That's going to help. Be honest with that patient. Patients with developmental disabilities, ask the patient about the patient's typical level of communication. Speak slowly, use short sentences and simple words. You may need to repeat or rephrase statements several times until the patient understands what you'd like. Persons displaying disruptive behavior, assess the situation, try to determine the cause of the patient's disruptive behavior. Protect the patient and yourself. Stay between the patient and the exit. Do not take the eyes off the patient or turn your back. If the patient has a weapon, steer clear of that patient and wait for the scene to be secured by law enforcement personnel. As soon as the person's safety can be assured, it's important that we still continue to carry out appropriate medical care. And do not take a disruptive patient to the hospital against his or her wishes. It can be judged as kidnapping, right? So we need to make sure that we're clear on patient wishes before we act. Medical terminology, just a little bit of an idea as to why that's so important. Medical terminology is a collection of technical terms used by medical personnel to identify anatomic parts of the body, identify and specify specific injuries and illnesses, and indicate treatments that are given. Your job as an EMR is to communicate your message to other medical providers as clearly as you can. We prefer that you don't use medical terms if you're not sure of the meaning, as new terminology is introduced. Look up the parts of those words and learn those commonly occurring prefixes and suffixes. And table number 5.2, also in your book, will give you some really great examples of some common prefixes and suffixes within medical terminology. It's really going to be helpful to understand those. In summary, communication systems allow you to relay information from one location to another. You must have a basic idea how your communication systems work at whatever organization you work for, because everybody's communication system, not everybody, but most people's communication systems are very different, right? So it's important we have an idea as to how they work. You must be familiar with the two-way radio communication and have a working knowledge of mobile and handheld radios, when you use them, and what information that's acceptable to transmit. Communication systems are used for different functions. The phases of an EMS call can include dispatch, response to the scene, as well as arrival to the scene, updating and responding EMS units, transferring care, and post-run activities. It's important that you learn and follow the standard procedures and protocols used by your department for communications. In addition to radio and oral communications, you must have excellent person-to-person communication skills. Body language and attitude are very important, and it's important that we take special care of individuals such as children, people with geriatric patients, our hearing impaired and visually impaired patients, non-English speaking patients, anybody who's developmentally disabled, and some persons who are displaying some disruptive behavior. And along with your report and your oral report, make sure you have a formal written handoff report that can be given to other EMS professionals at the scene. So this is a little bit of a short overview on our communications that's both interpersonal as well as in between us and our patients. It's important that we know as much as we can about successful communication, because it's going to make a difference to your practice as an EMR. Should you have any questions, comments, concerns, please reach out to your coordinator. And thank you for your time, patience, and energy. And we look forward to seeing you at our next discussion. Have a great day.